Hi, I'm Dr. Kim Shepard with Align Family Wellness. Today we are going to be talking about colic. What is colic and how can a chiropractor even help with colic? So I want to go through the definition of colic because I have mamas come in every day and they seem to be confused. They're like, well, my baby's colicky. I'm like, okay, well, are they? Let's go through some of the examples of what is colic, what's the actual medical definition of colic. So colic can be defined as long periods of uncontrollable crying in infants that last more than 3 hours, and it's happening more than 3 days a week. So I get it. Babies have fussy times at night. We kind of call it their witching hour, where sometimes they're just kind of fussy and just inconsolable. But true colic is crying for 3 or more hours, and that is more than 3 days a week. Colic affects 1 in 4 babies, which is a ton. I think we fail to address how hard it is on the mom, on the parents when the baby is crying that much. And 1 in 4 babies is a lot of babies. And then you add in babies that also have reflux or constipation or a lot of gas, trouble latching, trouble nursing, and we've got just really, really unhappy babies. So what are some signs and symptoms of colic? If you don't know if your baby has colic, let's go through them. Colic can be intense crying, and it's more like a screaming type crying instead of just like a fussy, like I'm unhappy kind of crying. Crying for no reason. If they're not hungry, if they don't have a dirty diaper, if they're not sleepy, and then they've had all these things and they're just crying and just miserable, we have no reason for it. So that can be a symptom of colic. Extreme fussiness, even after their actual crying phase has stopped. So just really fussy, unhappy, even though they may not be crying anymore, they're just really unhappy and fussy. So predictable timing. I hear this a lot with my moms. Episodes in the evening where they're just crying inconsolably or right after feeding. So like we talked about the witching hour, that can be just kind of winding down at night. They can kind of be a little fussy, but this is that 3 hours of constant crying and, or they're really, really unhappy after they eat. That can be a sign and symptom of colic. When their face gets discolored, they get really mad and they get flushed. And so we see a lot of discoloration in their face. A big one that I see in my office and that patients complain about with their babies is tension in their baby's body. Their babies feel tight when they try to hold them, or they arch back when they try to put them in their car seat or when they're trying to hold them. They don't like to be burped. They are cranky. They throw their head back and arch and neck back. Those are all signs of tension within the baby. Also lots of burping and gas. We, should have our normal amount of burps in between, nursing on one side or feeding in the bottle, taking a break and burping. But a lot of burping and a lot of trapped gas or just a lot of gas is not common for babies and can be a sign of colic. Babies that look uncomfortable. Their face grimaces, they just literally look uncomfortable. And the mamas come in and they're like, I know my baby is uncomfortable and I don't know why. So you guys know those uncomfortable faces. And then also having reflux or constipation or just projectile vomiting, all of that spit up coming up, or just constipation where they're not pooping and they're super, super uncomfortable. And then we get the grimacing and the gas and the crying. It's all part of it, mamas. It is all part of colic. So what causes colic? Because if we know the cause, then we can hopefully prevent it from happening to our babies. So there's no consensus in the medical community as to what actually causes colic. So then they really don't have a lot of solutions for you. They might throw a reflex medication at you. There's really not much the medical community can do for a colicky baby. So a lot of times they just say, oh, it's fine. They'll grow out of it by like month 3 or 4. It's fine. Just deal with it. So you tell a new mama who is struggling to wait 12 weeks and it'll be better. That's not good enough, guys. what happens is they actually grow into more problems. So they grow into chronic sickness, ear infections. Now we're constipated, sleeping disorders. Then we get sensory disorders when they're older. Every kid that comes in with a sensory disorder had some sort of colic issue when they were little, or at least most kids, let's say. So the answer is simply distress. These babies are stressed out. They have high amounts of stress and anxiety in their body. Mom may have been stressed and anxious during her prenatal period. So when I saw this the most was my moms and babies during COVID and like right after COVID. These mamas and these babies were so colicky, so fussy, so stressed out because of what we had to go through during COVID. Anybody that maybe had a job loss or lost a family member, a lot of testing where you were told, hey, maybe something's wrong with baby, and you have all these growth scans and all these things, baby's not growing. That is stressful on you, mama, and baby's nervous system actually absorbs that stress. Birth interventions are another major cause of distress in our babies. So that's forceps, vacuums, extraction methods. Moms that are being induced that are not actually ready for birth can be stressful on mom and therefore baby. Getting an epidural, having a C-section, these are all stressful events on mom that then cause baby to be stressed. So what happens is this constant state of stress affects their central nervous system or their autonomic nervous system. So their fight or flight system, their rest and digest, their spine, and their nerves. So this will send them into a state of stress in their spine, which is called subluxation. They also shift into a state of what we call dysautonomia, which is when their nervous system is stressed out. So when their nervous system's stressed, when we're in this state of dysautonomia, then these babies have trouble eating, sleeping, and pooping, which is the only 3 things these babies should be doing. So when they're not eating, sleeping, and pooping, then that's when they're fussy, and that's when colic sets in. So how do we treat colic? What do we do about it? What do we do about all this chronic stress? So first of all, we take care of you as the parent. It is not your fault. You did nothing wrong. It is not your fault. We give you a lot of love and support because we know this is hard. We know you are sleep deprived. We know this is a struggle, and we know it's going to take some time for baby to come out of this. So we really want to support you and encourage you that it's not your fault and you're doing a great job. So traditional treatments are, take the baby on car rides to settle them down, get them a white noise machine. We do talk about cutting some dairy, adding in some probiotics. Some of these things are effective and, you can kind of see them online. But what we have found, the biggest thing that affects these babies and gets them better faster is to get rid of the stress in their nervous system. And we do that because we are trained pediatric chiropractors. So we use gentle and effective and easy adjustments that unwind and release the stress and tension that's built up in your baby's nervous system and spine. So very, very gentle, light pressure, pressure like you would touch to check if a tomato is ripe or if an avocado is ripe. So very, very light, gentle pressure, but that helps to remove the stress. In my office, we also do a series of stretching, and I show you some stretches to do at home with baby. But we always tell our moms, be aware when your baby gets adjusted, they're going to sleep a lot and they're going to poop a lot. So that's always fun because when they come back, they're like, you're right, they did. They pooped and they slept a ton. So we use our insight scans in our office to tell us exactly where that stress is stuck in your baby's spine. It shows us exact spots that we need to go to and affect and adjust to make them feel better and to actually remove that stress in their spine. So if you guys know a mama who's struggling or a baby who's struggling, please share this video. Please pass it on. We would love to take care of them. Give our office a call if you need anything. Thank you.